All right, so to wrap up, when we're talking about the 5 tenets of health, here at the Live Well Clinic, we are working with people, yes, with some chronic disease and some health challenges, but a lot of it comes down to these 5 main components that, if we're not getting these right and doing the best that we can in these areas, a lot of other things that we do are going to be really, really tough to create that change that we're needing. So number 1, we always talk about sleep. Probably the most easiest thing out there that we just don't give enough attention to. And it's been clearly documented that even if we're not getting about that 7 to 8 hours of sleep, dark sleep a night, we're not allowing time for us to rejuvenate. We're not supporting our brain health. If we work out and exercise, we're not allowing that tissue to regenerate. This is a huge tax to our immune system. And a lot of the stuff that we see and the conditions we see in our office is immune system related. And, so it's challenging to say if we're not going to get the adequate sleep that we need to push past that barrier to get to the optimal health that we really need. So number 2 comes down to what we talk about is stress. Now, stress is not necessarily I'm overwhelmed, my job's terrible, my favorite football team lost. There's a lot of things into that category, but I think what I'm thinking about more and more is this biochemical, physiological stress. Now, what the heck does that mean? Why do I care? It's saying, are there chronic infections? Are there immune challenges that are underlying that are not allowing the body to get over a hump? I mean, we see people with chronic anemias, meaning they don't have enough, let's say, iron in their life, and that goes overlooked from their medical providers, and that's probably one of the key things that is causing issues with their health. So that's considered a stress because it's putting the body in a state of dis-ease, so not being able to optimally repair and rejuvenate the way they need to. So number 3 goes back to nutrition. We do talk a lot about nutrition in our clinic. We don't want to be known as, and frankly, I don't think this is the way it should be with people's health, is that, I just need to take a pill or I need to find the next coolest vitamins online. There may be some good to that, but the problem is I think a lot of it's coming back to what people do in their choices and their diet. And this goes back to we're living in a state today where water is the most toxic it's ever been. The air is the most toxic it's ever been. Even the foods that we eat, a lot of the meats and the poultry and the fish, extremely toxic if we don't watch out for this. Now, yes, it may be extremely cheap to get, but think about what you're putting in your body, which actually is leading back to the previous point about adding that extra stress to allow the body to work well. So we always try to work with people and say, what are the sourcing of the food we get? Are we being conscious of these decisions? Because everything that goes in your mouth is going to have an impact one way or the other, good or bad. And to achieve that optimal health in that state that we're trying to help correct in someone, we got to make sure that these things are probably the best that we can do. So we need to evaluate those things. The next area we talk about is hydration. And hydration, it's another simple one that we think about and that people say, well, yeah, I drink water. How much? I don't know, enough. I really challenge people to at least get half their weight in ounces with water per day. So if you weigh 200 pounds, shoot for 100 ounces of water a day, get a bottle or some kind of a jar or something that has a measurement that you can kind of count and think through. That's going to be a good way to shoot for that. I think we all get busy and overwhelmed and running around that we just don't think about it. And by the end of the day, we're not drinking enough. And lack of water, lack of hydration has been shown to cause anything from blood pressure issues to chronic migraines and headaches, not sleeping well, and metabolism. It's been shown that we can't process and metabolize fat correctly because you need water to help that process. So when we're looking at, again, correcting disease and being optimal in our health, some of these basic things, if we're missing, it's just going to be really, really hard. And we're trying to tug and pull one end, but we're not having the other end supported on the other side of things. So the last thing that we really want to stress and talk about in our clinic, and this can be a challenge for probably the most people that we see, is the movement factor. Getting adequate exercise and movement throughout the day, and it's more than just, let's say, I mow my lawn once a week. It's probably purposeful, dedicated time to move, and it can be simple as walking 20 minutes a week, 3 times a week. 20 minutes 3 times a week, a little, brisk, not easy. Trying to get the body movement. I mean, you're moving garbage and toxic material around in the body. You're helping muscles and joints to kind of repair and to grow. And it's also been shown to be really, really healthy for the brain and joint health as we age. And that's going to be extremely important for everybody watching this. So Again, 5 tenets of health. Why do we say these things? Because I know typically in my practice, when I would work with people, they'd say, yeah, I get that. I got to drink enough water. Or yeah, whatever, sleep, not a big deal. I run off 4 hours of sleep. We have past presidents that, brag that they slept 4 hours a night. So, but I saw challenges with people. People were not getting better. They were not getting over obstacles and challenges. And it's more than just about, let's say, pills you take, and it's more than just about doing a lot of fancy tests. There's a lot of benefit and value to that, but there's a lot of basics that I know at the clinic that we really strive to get people to work through and to really support, so that way they can flourish and live well and make their treatment programs the most effective that they can. So with saying that, I highly invite you to come to one of our next live sessions here at the Live Well Clinic. It's in person. We get to kind of meet some of the staff, learn more about us, what we're about, and how we truly get to underlying causes of diseases, and not just saying we want to throw stuff at you. Because we hear a lot of stories from patients. We hear that they're not being heard. We hear that they're stressed because it's causing some family dynamics where maybe the spouse doesn't believe that they're feeling the way they do, and there's not a lot of support there, and that's a big stress, and we got to work through that. Sometimes their own medical provider has said, it's normal for you, you're aging. I've had women tell me that going into menopause at age 30 is normal. That is not normal. We need to find what the underlying causes are, and I know we can help you do that because we've done this for over 15 years. So I invite you to the next live session. Click below, and we look forward to seeing you soon.